Before the pandemic hit, we were just your local community clinic. People experiencing homelessness don't have access to a cell phone consistently such that they can call for appointments or that we can reach them. How's it going? We're testing for the coronavirus. We can't treat these people through telemedicine, but we can actually just walk out to them, try to identify who they are, what their needs are, and treat them that way. Write down address right there.
So the homeless population in Los Angeles is, at any given moment, over 66,000 folks. While Safer at Home might be one of our most effective tools against the pandemic, if you don't have a home to go to, it's sort of meaningless. I'm Danielle Wildcrest. I'm the Chief Program Officer for Brilliant Corners. As a response system, we have, in the midst of many things shutting down, actually scaled our response. We moved more people into housing in the early months of the pandemic than we had in the previous months.
At the moment that there was community transmission, we knew that we had to very quickly put resources in place to make sure that our most vulnerable, people experiencing homelessness, had access to the testing and isolation resources that we knew were critical to mitigating the spread of COVID. Brilliant Corners was really quickly able to move in and establish staffing, supplies. They were able to mobilize and move things within short turnaround times, hours or within days, which wouldn't have been possible with our county processes.
That's why we're back and kind of letting everyone know so that you guys can take the proper safety measures.
Everyone has stepped up to the charge, even in uncertainty and sometimes in fear, with a willingness to really want to serve.
On some level, our team had an immense feeling of being unprepared for what was happening. And on another level, we had been preparing our whole careers to be able to really rise to the challenge.
The planning is one of the hardest parts, and that's done through DPH. And then the locations that we go to are scouted out by the outreach team. DPH was able to essentially organize all the testing supplies and make sure we have enough testing supplies. And then the outreach team has all the connections to each individual encampment and members already. The most important thing to highlight is that the education potentially could have prevented a larger spread. The fact that there weren't very sick individuals in this encampment and that there wasn't a bigger spread, I think is important.
Our work in this was to leverage our infrastructure around fiscal management. So the California Community Foundation was able to be nimble and make an initial investment of about $400,000, which allowed us to immediately work with the Department of Health Services to set up contracts for nurses and other kinds of medical staff who could go out with the outreach teams and actually do that work.
CCF was able to track what we were doing. They were following what our different response efforts were, and they were able to align funding in really critical ways. And we're able to bolster funding and resources to community-based partners and federally qualified health centers in order to provide the services that were required to meet this need.
I think that pandemic has highlighted what's always been true, which is our community health is interconnected with all of our neighbors. If we choose to prioritize moving forward a racial equity lens, a housing justice lens that makes sure that all of our neighbors have a safe, affordable place to live, we will not only be doing the more humane thing, but as a community, we'll be so much better prepared for whatever new challenges ahead of us.